back over to Mireia for our closing session of the day. Thank you.
Thank you, Lara. Thank you so much. And hello, everyone, again. And for those who don't know me yet, I am Mireia Figueras, Climate Program Manager at Healthcare Without Harm Europe. To wrap up, we are excited to have two exceptional experts who have been at the forefront of sustainable healthcare to share their insights with us. I would like to welcome to the screen Mireia Gaden and James Dixon. Mireia Gaden is the Chief of Development at Centre for Sustainable Hospitals, Central Denmark, and board member at Healthcare Without Harm Europe. And James Dixon is Associate Director of Sustainability at Newcastle Hospitals and Vice Chair of the board at Healthcare Without Harm Europe. Thank you both for joining us today to have a conversation about the future of the transition to net zero and climate resilient healthcare. To kick off our conversation, could you both share a bit about your journey in sustainable healthcare and decarbonization? And also acknowledging that today it's the World Mental Health Day, it would be great if you can also share how important you think it is to foster mental preparedness to address eco-anxiety and to ensure the continuity of care during climate emergencies. I would suggest that first, James, you answer, and then you can go next, Mireia. Thanks.
Thanks. Hi, everyone. So I've worked in healthcare sustainability for almost 15 years now, and it's been quite a roller coaster of emotions. So I first started this portion of my career as a lone environmentalist in an organization that was very large, so a group of hospitals with about 15,000 staff at the time. So I was able to make quick wins, save a lot of money and carbon, but then I built a small team and an identity, so that's where SHINE, Sustainable Healthcare in Newcastle, came in. So we made good incremental improvements, which is great, but then in 2018, I became increasingly concerned because the transformational change that we needed to happen just wasn't happening. So as an environmentalist, I felt like I was complicit in just perpetuating that kind of challenge. So the winter of 2018 was really, really hard for me. I was suffering from eco-distress. So Judith was talking about that in an earlier session today. Became depressed because I was maintaining the status quo, genuinely angry at government inaction, felt shameful of my own actions, and was really, really scared for my children's future. So with help, I was able to focus on what I could control and influence. So this led to me pushing our board of directors to recognize the importance of this work in health. And then we became the first healthcare organization in the world to publicly declare a climate emergency. So drawing on what Judith touched on earlier, which I thought was a brilliant session. So if anybody didn't manage to make that, go back and see the recording. I've realized the importance of three things. So speaking the truth. So Judith referred to this as breaking the silence. So that was where our declaration came in. But find your tribe. So we talked a lot about this, and there's great networks at Healthcare Without Harm Europe can help with that. But come together regularly, make sure you protect time for that, and be open to share and learn. And then just normalize the emotions of eco-distress. So there wasn't this terminology when I was depressed those years ago, but now we know that grief, anger, and anxiety are just healthy human responses to the crisis that we're facing. So, don't be afraid to talk about that, listen to other people and help them where you can.
Thanks, James. Over to you, Mireia.
Yeah, thank you. And thank you for sharing, James. My journey into this area started when I was a midwife, because that's my background. And I have about 10 years of clinical experience. And I think in my private life, I've always treasured nature a lot. And I grew up in the countryside, and the forest was my favorite playground. But somehow I shut down that track in my own personal value when I entered the hospital until a certain point of time where you could say society in general had a rising awareness upon the green transition that was needed in order to reduce climate change. And I became increasingly frustrated that we were not talking about it inside the hospitals. And I've heard about an expression from a Danish professor who is doing research in this whole mental sustainability area, and he has this expression called cognitive dissonance, which is when there is no resonance between the values you hold inside and then the values that is represented or being acted upon, at least in your organization. And there was definitely a dissonance within my personal values regarding nature and my organizations. At the same time, it was dissonating with the fact that my whole organization's basic value was to do good. So this was just off track in two ways to me. So I started taking action and started with smaller projects. I had no idea if I started at the right place. To be honest, I started where I could. I reached out to leaders, and luckily I had some leaders that supported me. And in some years, it grew dramatically, also in the whole organization. And today, we have Center for Sustainable Hospitals with 19 employees, and we have sustainability consultants in hospitals and have built upon the organizational structure. So it has been both very encouraging that it is happening so fast, but at the same time, I resonate with what James said, that it's frustrating to see because there's happening a lot, but still it's not enough. And I mean, that's the balance you have to cope with all the time. So I think I try to stick to the fact that it's not too late to make a difference. It's not too late to improve, and no change is too small to be part of the bigger change that we need.
Thank you both for those insights. And shifting now the conversation to talk about the changes actually that are needed. If we look forward, what milestones should we aim for in the next 5 to 10 years to ensure that the healthcare sector is on track to meet net zero and climate resilience goals? And you can start, Mireia, and then James, you can go next.
Okay, well, first of all, something that has also been mentioned today, it will be in the curriculum of all healthcare professional educations. That shouldn't take 5 years, but definitely in 5 years we're there. It should also be represented in the legal framework as the phase-out list of chemicals and stuff like that. No exceptions for the medtech industry, no, by that point of time. We're past that. And then I say maybe we don't even have a sustainability strategy in my organization anymore. I hope we don't, because it has been embedded into all the other strategies and goals that we have. It's no longer necessary to keep it for itself while trying to integrate it in order to make sure it gets attention. It will get attention as being embedded in all the other goals we have. So at some point of time, that was maybe 5 years, hopefully. And then you said 10 years also. And I hope that as global society in 10 years, we have a more holistic view on the economics that includes finances as one resources that we are focused on to be balanced. But that's just one kind of resource that we focus on balancing. It's also nature's resources, CO2, it's the raw materials, it's the healthiness, it's the well-being of people, that we somehow stop talking more about resources as the basic of a healthy, well-functioning society, more than we talk about the finances.
Thanks, Mireia. And James, what do you think about it? And what are your answers to that?
Well, I think it depends on your context, definitely. So I'll be talking from like a UK perspective, but depends on your country's healthcare system, what the targets are, and where you find yourself. But I think there's themes that I would try to draw out, and I like to put them into 3 so people can remember. So people, I mean, Maria's already talked about this, so I would focus on educating, empowering, and inspiring our healthcare workforce to act on sustainability. So whether that's to deliver lower carbon care pathways, if you're a clinician working with various royal colleges and their special interest groups around environmental sustainable healthcare, and baking that into their curriculum, but also their practice. So how do we get that into policies, education, and training? So that's really embedding it in there. But also how we embed it into organizational culture. So Maria's talked about that already. So it would be lovely to not have, my profession as a chartered environmentalist and sustainability profession as a little offshoot to the side of the organization. In the private sector, there are chief sustainability officers. So there's C-suite people who are there to, kind of fight for the planet, if you like. They're not always respected as much as they should be, but that will take a long time for that to happen in healthcare. So wouldn't it be great to just value, planetary health? So we try to care for people and planet. That's the kind of mantra I'm trying to push forward at Newcastle. And then the other one I would say is carbon. So, as an environmentalist, we need to root carbon as a proxy for greenhouse gas emissions and rapidly phase out fossil fuels in our healthcare systems. And, you're aware of a lot of that work, Mireia, and what we're trying to support within Healthcare Without Harm Europe. We should do that within the science and we'll realize global health benefits, but also local health benefits just purely from air quality improvements. So I would definitely focus on carbon and decarbonising our hospitals and healthcare. And circularity. So consumption is often, the poor child talked about when we cover carbon. So moving from linear economy to, more circular economy. So how can we champion more reuse, really, really challenge single use that has become pervasive in healthcare under the kind of safety auspices when you talk to infection control colleagues and others, that has just come into practice without really them pushing it. So really, really challenge that. They're the three things that I would focus on.
And can I just comment on that?
Yes, sure. Go ahead, Mireia.
Absolutely agree with what James said. And I think besides that, we should have established, hopefully in 5 years, something called PrevTech Europe, maybe. We have the MedTech Europe, which is all the medical technical companies' interest organization, and they're doing an excellent job. But I'm really curious on how we will break the code in order to make prevention an extremely good business for those who are running it. Because when you look at who's earning the most money within the healthcare sector, it is the one curing the diseases. But could we somehow manage to flip that coin? I do not have the solution. We need some economists. We need some other people to join the field and join the team here. But how can we as healthcare system find the business models that makes prevention attract more focus financially? And I know I said that finance should not run the future in the same way as it does now, but they're here. And it's an interesting fact, I think, that right now it's not where the most research money and investments goes, but it should be. So hopefully we're treating a lot fewer patients within the hospitals in 5 or 10 years.
Thank you both. And now I would like to bring us back to the present, actually, and ask you to share one action that you would urge every healthcare worker or leader here today to commit to when they return to their organizations. James, you can start.
Well, that's incredibly difficult. But if I think when I started on my journey, so people might be starting the journey, people might be far on their journey, but certainly at the beginning, if the advice I'd like to have received when I started was keep going. Don't be fazed by the scale of the challenge. So you might be a lone voice, in your organization, but that will gather pace. And for every closed door or opportunity that you think you want to try and put forward and it gets knocked back, there'll be plenty more open doors that you can, get your energy from feeling like you're progressing things. So that certainly worked well with me. And there has been more doors open than doors closed. Believe me, I've had a lot of doors closed. So that's what I would really, really advocate for people.
Thanks, James. What about you, Mireia? What would you advise to someone that is starting, or what is one action that you would urge everyone to take?
Don't be a one-man army. That's a Danish expression, one-man army. Don't know if you have it, but don't do this alone, and don't try to do this alone. Start out by reaching out. There's definitely other than you who are sharing the same thoughts and the same concerns, and it's that tribe thing you talked about, that's really important, and make sure that in your tribe you do get leaders as well, because they play an important role in order to drive it forward. So really create a team around you. That's very important.
Thanks, Mireia. And moving to the final question, We've touched on challenges, solutions, and what needs to be done moving forward. But as we close, I would say it's also important to bring hope, and this was also acknowledged during the day today, and also optimism into this conversation. We all know that addressing climate resilience and healthcare decarbonization can feel overwhelming, but hope is what drives action and innovation. With that in mind, what gives you hope or optimism about the future of the topics that we discussed today? Mireia, you can maybe go first, and then James.
Yeah. Well, if I could revisit myself 6 years ago and be in those shoes again, if I had looked around and had said to myself at that point of time that if this is all we can do, then we won't reach our targets. If the future is somehow mirroring the present, or in regard to how much is going on in this field, then I would have lost hope, I think. So I think what keeps my hope up is the fact that I could not in any way have predicted that so much would have happened within these years, that so much would have succeeded, that so many people would be engaged, that we would have a strategy, that we would have goals, that we would have a national cooperation, which is way beyond what we had at that point of time. So I think somehow believing that this development can be exponentially increasing again and again and again, then I hope that right now I can't even imagine how fast it can go within the next 6 years.
Thanks, Mireia. What about you, James?
I can't really top Maria's. That's really, really good. I think when I managed to convince our board to declare climate emergency, I didn't know. I just wanted them to take it seriously and know it was important for health. I didn't really know what the outcome would be and what I could expect of that. There's been a number of challenges since then. We've had COVID, there's austerity measures and, hyperinflation in the UK. But what is giving me hope all the time is the fact that we've inspired or allowed our clinical teams to really take this seriously and reach out to us and work with us on that. So, we're still a small team. We can't help everybody, but we are doing some great work. There's a project, Born Green Generation in particularly, that we're trying to work with Healthcare Without Harm Europe support as well. And that's on reducing plastics and chemicals within maternity services. So what gives me hope and gives me energy is working with clinical colleagues, because I've worked behind the scenes for enough with finance, procurement and estates people. So it's really, really good working with clinicians.
That's great. Thanks, James. And thank you both for that. Oh, sorry, Mireia. Yes.
I just wanted to add something, saying that this whole international cooperation and all these relations that have been grown during the last year really gives me hope as well. I think we are stronger connected. We are my organization at least. We're much stronger connected internationally than we were just 3 years ago. And that's also very strong sign that things are moving.
Thanks. And that's exactly one of the main objectives of this summit, to connect people and grow this international network. So thanks, Mireia, for bringing this up as well. And thanks both for your insights and inspiration. It's clear that while we face big challenges, the passion and expertise is in the room, and this gives us real hope for the future. Recognizing that there is still so much to do, let's take what we've learned today and turn it into meaningful action when we return to our organizations. Thank you to everyone who joined us, and let's continue this vital work together. I want to remind everyone that as we wrap up the summit, we also have now networking roundtables. So there are 3 topics available: decarbonizing healthcare climate resilience, healthcare professionals, and healthcare climate resilience. To go to the networking event, just go to your page and select networking tab at the top of your homepage screen. And as soon as this session ends, you can choose a seat at the round table that interests you the most. You can choose a seat by clicking on a spot on the sofa around the image of the table. And because the round tables have limited capacity, we have made 2 tables available for each topic. So we encourage you to grab a seat at the one that is less populated, so that we can split the attendees and have engaging conversations in every room. The tables will go live now. And we look forward to engaging with you in these smaller collaborative discussion groups. We sincerely thank you for joining us today for the European Healthcare Climate Summit, and stay tuned for the reports about the conference. And thanks again, wishing you a nice rest of the day. Thank you.